let's start our question answer session for the presentation that we had, or you could say webinar about autism in autistic girls and women. So जी क्वेश्चन है आपका कोई?
Yeah, Assalamu alaikum.
Welcome, Sam.
I just wanted to ask, a girl with the autism, does she like to control some, like, उसमें ऐसा है कि किसी को control करो? Like one of my students, she likes to control, keeps giving orders to other students.
I think you came a little bit late. I just talk about those things because why they would like to do that. It's more like एक तो हमें ना, if you look toward that thing, it look like that they're controlling in the other perspective. But when there's a situation is unknown for them, it gives them anxiety kind of state. Like it could be panic kind of a state because things are not in their control and environment is not comfortable for them. So why would she do that? Because she want to have a control environment in a sense where she feel comfortable. So it is more like that. So she want to have a leadership role, you could say. And people, whenever we talk about that controlling thing, when we talk about set of they're doing certain things, it more like give the profile of negative aspect. Yeah, they are controlling, they are manipulative. So why they are doing, why a person will do that? Because she might be thinking for all kind of scenario in brain before that, before coming to class, before coming to school, even one day before the school. So that's how it's going around. So like अगर हमने पहले बात की कि वो थोड़ी मदरिंग वाला कॉन्सेप्ट है उनके अंदर. So they could act like their elder sister in certain situation. So that's why she might be doing that. And I don't know other thing that why she's doing that, but one response could be that. And certain और कुछ हमारे there are few we have some certain therapies which reinforce those kind of a thing. If you will do that, I will do that. If you will do that, I will give you this. Why don't you do that? You will give me that. This give and take kind of a thing. So that's why she might be also doing that. So I just give you 2 or 3 aspect, because I don't know exact state of her, but this could be a reason.
Okay, thank you so much.
Okay, so where are you working? Is it a special school? Are you a therapist, or you're a parent, or you're a teacher?
I'm a special educator in Vocational Rehabilitation Center. I work as a special educator.
Where you're working?
VRC, Vocational Rehabilitation Center.
Where is that place?
Karachi.
Okay, you're from Karachi.
Yeah.
I just have heard BRC. I just look at, sometimes things come in front of you with this name, but I thought you're because I'm from Islamabad, and people think that I'm from Karachi. I'm not from Karachi. I don't live in Karachi. Okay, so Kamal, do you have any question? Kamal, you can unmute yourself and can you ask the question?
Is it okay if I ask another question, please?
Yes, you can ask. No issue.
I just want to know how to deal with a child. She likes to tear whatever she got. Like school में तो ऐसा नहीं होता है, लेकिन घर में ऐसा होता है. वो boxes को फाड़ देती है, छोटे-छोटे pieces करती है, and then she throw it everywhere. Her mother keeps on complaining of doing this, but I've never saw her any time doing this in the school. Like school में तो she's like too good. I would count her too good because whenever we give her instruction, whatever instruction we tell her, she just do it with a smile and happily. But at home, her behavior is totally different. Then her mother complains, and I don't know exactly how to deal with it.
Let me tell you something. Why she's not doing that at school? Because she is busy with you people all the time. You're giving her activity. You are giving her challenges over there. But when we look toward our home setting environment, then children don't have activities to do at home. Like what would they do? But people or what parent do कि this child is autistic, this girl is autistic, हमें इसके साथ ज्यादा करने की जरूरत नहीं है क्योंकि इसकी थेरेपी हो रही है. बट अगला बच्चा, इवन अगर बच्चा होगा, if it's a male child, तो उसके तो बहुत कुछ कर रहे होते हैं. That's why पॉइंट इज दैट वो क्यों निगलेक्ट हो रहे हैं, द गर्ल इज गेटिंग मे बी निगलेक्टेड, वो निगलेक्ट शायद हो रही हो वहां पे, या वो एक्टिविटीज के पास कोई और करने को ना हो, जब वो कुछ और नहीं देखे, इवन देन इट इज एन एक्टिविटी, जब वो चीजें फाड़ फाड़ के कुछ कर रही है, तो चीजें फाड़ेंगे तो डेफिनेटली मदर उसकी तरफ आएंगे, उसको रोकेंगे, उसके साथ टाइम गुजारेंगी, यू नो, दिस इज व्हाट इज हैपनिंग
Okay.
ओवर हियर, एंड वी डोंट सी व्हाई अ चाइल्ड इज डूइंग दैट, एंड there are so many reasons behind doing those things. Even
Means
talk about
just
stimming,
for
there is reason before stimming. Why child do
to
the
seek
stimming?
attention.
You know?
Sh-
So
Yeah. Okay.
we need to understand why a child is doing that. Either
Uh-huh.
she is getting the time, अगर for example बेशक सारा दिन आप टाइम ना दें उसको, देना तो चाहिए, but the point is that quality time चाहिए होता है बच्चों को, attention चाहिए होती है, you know, something like that. So
Mm.
you need to understand that why the child is doing that, because कोई भी चीज जो है ना, it's the behavior is not coming from the air, thin air, कहीं से ऐसे नहीं आ रहा होता, you know, वो कोई रीजन होते हैं, फॉर एग्जांपल अगर स्टिमिंग जो है, जो से हम स्टिमिंग की बात करते हैं, that is a
Mhm.
thing that a child is doing because to have a sense of environment, when a child is not comfortable over there, when a child is not having any activity with themselves, so the child doing those things, and the child is intense, you know, the situation is intense around that place, तभी बच्चा ऐसे कर रहा होता है, that's why the child is doing that. So you need to understand why the child is doing that.
Okay. Thank you. Thank you so much.
Samreen, do you have any question? I have very yes, 2-3 minutes if you can ask any question. Do you have any questions, Samreen? Okay. Khadia, do you have my number?
Yes, I do.
Okay. So I was saying, if you have any suggestion for the, you know, for the topic that you want to discuss for next, you can give the suggestion. And I think I need to go. And if there is not another question, then see you in the next. And thank you so much for coming, and see you in the next session.
Thank you. Thank you so
Nice
much. It
talking
was
to you. Thank
wonderful
you so much for asking
webinar.
amazing
Thank you.
question. It is very important to understand that, you know, as a teacher, even as a parent, as a teacher, as a therapist, you need to understand that what is happening with a child. अगर वो कम्युनिकेट नहीं कर पा रहा, करना चाहता लेकिन नहीं कर पा रहा, सो उसके पीछे क्या है, क्योंकि बिहेवियर फिर कम्युनिकेट करता है ना आपका. So that's what is going. So thank you so much and see you in the next. Allah Hafiz.
Love.